Hi, guys. It's Juhi here, and welcome to another podcast episode. And this time, I would be busting some myths around supplements. That can be actually discomforting at times, but yet you need it. And what can we do about it then? Just to give you a general knowledge around certain supplements that we all are using, and it's the hype of the town at the moment. But before starting, I just want to tell you all that supplements actually can be divided into different categories. For example, there are nutrient based supplements like B vitamins and minerals. There are targeted supplements. There are gut and microbiome support supplements. There's even specialty or functional support supplements. And even amino acids and proteins are a part of the supplement array. Even performance and energy support. So supplements are such a indispensable part of our life, and I think it's become that way nowadays because our food quality is not enough to provide that. And we do need supplements to just supplement us a little, though food will always remain as medicine at the core of it. But supplements are something that we can use acutely and even on a long term basis, but with a little bit of common sense. And what do I mean by that? Let's start with different supplements and discussing about them. So the first one is actually methylated B vitamins. Now you may ask me that what's methylation, right? So methylation is basically adding a methyl group to a neurotransmitter, to another molecule, for example, a neurotransmitter or to DNA or even to some proteins. And it is this methyl group, which is one carbon with three hydrogen atoms. It helps with DNA regulation. It helps with liver detoxification, with removal of heavy metals or estrogen, and also with neurotransmitter balance and energy production and all of the good stuff, even actually reducing homocysteine, which is the harmful amino acid, and it needs to be converted into methionine, which can actually help with cardiovascular health. So, but sometimes when people are using methylated B complex supplements because of overmethylation, that could be the neurotransmitters or the detox pathways, they are getting very stimulated. Or the person is having some genetic variant, or maybe the person could be dose sensitive to the methylated forms of B vitamins, which are highly absorbable. So, what can a person do? They can actually go for something because with methylation, we need these essential nutrients like B6, B9, B12. We need betaine, we need zinc, we need magnesium, we need choline. So, and the methylated forms are mostly B9 and B12. So instead of going for methyl folate, a person can actually go for something like folinic acid. And instead of going for methylated B12, which is methylcobalamin, a person can actually go for hydroxycobalamin or adenosylcobalamin. So these are good ones to use instead of the methylated forms. And the person can tolerate it better. And some of these symptoms a person can feel from overmethylation are irritability, insomnia, anxiety, headaches, even histamine intolerance, and rapid heartbeat. So I would suggest for people who are actually feeling very stimulated, do try going for something which is a non-methyl B vitamin and try it for some time. And if that one works for you, it's the best. Now the second one is also something very important, and it's also the talk of the town at the moment. It is DIM, and it's estrogen remover, as they say, with estrogen metabolism. But DIM is dolomethane. And this one is a compound which is derived from cruciferous vegetables, for example, broccoli, cauliflower, kale. This one really helps to actually shift the estrogen metabolism towards a healthier pathway. But this one isn't suitable for everybody because women who are suffering from poor estrogen metabolism cannot convert this type of estrogen into 2-methoxy E1 estrogen, which requires a methyl donor for methylation. So again, if you are someone who is a bit intolerant to the methylated B complex, I would say avoid a DIM supplement as well, because you might be even sensitive to that one. Because again, you need all these methylation supporting nutrients, and it can actually cause like headache, anxiety, fatigue, and that's not the goal. But we also have to realize that DIM can very effectively and quickly detoxify phase 1 of the liver detox, and but the phase 2 is actually weak. So instead, the estrogen metabolites that needs to be cleared, it's actually getting all blocked and stagnant and leading to more hormonal related symptoms. So DIM can also at the same time irritate the gut, and it can cause some nausea, gas, and diarrhea as well. And on another note, it's a very important point that if someone who is trying to eliminate estrogen or metabolize estrogen from the body, they need to first take care if they do not have a constipation issue or a slow motility, because in that case you might be reabsorbing estrogen into the body, which is again beating the whole purpose, because we need it to be eliminated rather than stuck inside the body. And DIM is so effective in doing so, but you cannot eliminate it because your detox pathways or your eliminatory channels are blocked. Third point, women with low estrogen should actually avoid DIM at all because it can actually cause further issues. Something like vaginal dryness or low libido, even the egg quality can go down, and hot flashes. So people who can actually take DIM are someone who have a good liver status and they do not have liver disease, hepatitis or chronic alcohol overuse, can tolerate DIM better. Even someone who doesn't have a MTHFR or a methylation issue can use DIM. But if you're already having an issue with methylated B complex, do not use DIM. Do not use it. So I would say that often younger adults or those without any autoimmune hormonal issues can actually use DIM. I would say in general, what you all can do if you just want to be on the safe side and don't want to use DIM, you can actually do broccoli sprouts. 1 to 2 teaspoons in a day for active detox in cases of fibroids, PMS, endometriosis, even hormone-sensitive cancers, and toxic buildup and sluggish liver. It's just absolutely amazing. And apart from these, there are obviously herbs like blessed thistle or milk thistle, which can help for liver detox and for reducing estrogen and increasing progesterone. Things like white peony root is absolutely great. So we always have options. We just need to look around. Now, the third one is actually something amazing, and I guess everybody just loves using this because we know the health benefits, and it is C. But now the case is where people have loose stools. That means they're losing a lot of nutrition if we take vitamin C beyond our bowel tolerance. For some people, it could be 2 grams. For some people, it could be 12 grams. But 12 grams is the limit that we can take in a day. Though some people who are more sensitive can be stuck to 2 grams, but they can also add in something like amla powder or kamakamu or even hibiscus tea, for example, just to increase their vitamin C storage. But as you know, it's amazing. You need vitamin C for iron absorption. You need vitamin C for collagen synthesis. You need vitamin C even in your thyroid hormone regulation and function. So it is such an important vitamin that we need for detoxification for every cell to function well. The next one we have, which is, I think everybody is deficient in this vitamin. And it's not even a vitamin, it's a pro hormone which our skin can make. Any guesses? Yes, it's vitamin D. And obviously, the reality is that we as species, we have moved towards more temperate climates, wherein we were supposed to be in tropicals, so that our skin was always exposed to the sun. But the reality is that we are always indoors, and especially in the winter time. So our skin cannot make a lot of vitamin D. You cannot ignore this. People who have fibromyalgia, people who have seasonal affective disorder, people who have cancer, people who have myopathy, breast tenderness, need vitamin D. But on the other side of the spectrum, overdosing on vitamin D is also bad because that can actually create high blood pressure, skin issues, that can actually create more thirst, more urine, itching, bone loss, and even renal failure. So balance is key. If you are someone who has tested for vitamin D and you're lower in your vitamin D levels, needs to be between 60 to 80 nanograms per milliliter, and try to keep it at 75. That's what I would recommend everyone. You can amp it up slowly, like 5,000 for 2 weeks, 10,000 for 2 weeks, then amping up to 15,000 IU. And then again reducing it for to 10,000 IU 2 weeks, and then 5,000 for 2 weeks, and then retesting again after 3 months. So just to amp up your vitamin D levels, you need to do that. And after that, you can go to maintenance to 4,000 IU per day. So it's that critical. But with overdosing, there can be the calcium can be mobilized and it can get into soft tissues and cause calcifications. So that's why it's really important that if you are supplementing with vitamin D, a hormonal D3 supplement, then you should definitely get your levels tested and keep testing it in every 6 months. All right. So let us move on to another one, which is also important. And everybody's scared, I think, of this one, which is vitamin A, because these are fat soluble vitamins, and vitamin A can also get accumulated in the fat tissues, and they can cause a lot of issues as well. But issue can happen when you are dosing at such large amounts of vitamin A. For example, 666,000 for 6 months. Now, no one is stupid to actually dose to that level. Pregnant women, beware. You don't need to take more than 10,000 IU, or even less than that is great for you as a maintenance dose. But if it is something for natural healing, doing something like 100,000 IU for 3 days and then reducing it to 50,000 IU for 2 weeks, and then going back to your maintenance dose, which is from 3,000 IU to 10,000 IU. It's great. It's not going to overburden the liver and again clog your detox pathways and more so, and cause hypervitaminosis. That's not going to happen if you're doing something therapeutically, which is for a short period of time. But we do need vitamin A when people have night blindness, or we need it for the immune system. We need it for our retinal pigmentation, and it's also used in cases of burns as well, connective tissue, and even with cut lining. It's actually recommended with leaky gut. So there are so many benefits to it, but a person should be diligent enough as to how much to use at a particular point of time and their particular situation. Isn't that a myth busting, I would say, with vitamin A? Because I think more often we get scared with it, but the more we embrace it and use it in the most logical manner, it really works in your favor. Now, moving on to something which is not an essential vitamin, though we do need it in very less quantities, which we can also get it from our food, like avocados. But sometimes we do like to just supplement with it. And this one is vitamin E. When a person has burns or leg cramps or scars or even neuromuscular disorders, fibrocystic breast, for immune enhancement, for multiple sclerosis, for cataracts and atherosclerosis. So this is such an important vitamin which we can get from food, but if we are using it therapeutically, we can actually ramp up this vitamin as well and almost go up to 800 IU to 1600 IU per day. And in fact, that one thing we need to really be careful about with vitamin E is not to use a lower quality form of it, which is the DL alpha tocopherol. In fact, we need something that's mixed of tocopherols and tocotrienols and use it around, for maintenance, use it around 400 IU per day, which is great. But if you are someone who is on going for a surgery or even after surgery for few days, you shouldn't be using vitamin E at all. Once you're settled in for a week or so, then yes, you can start using vitamin E. If you are someone who is on anticoagulants, on blood thinners, then I think just keeping to the maintenance dose is enough. So as you all can see, with a lot of vitamins and supplements, there's a logic. It's very case dependent, and we shouldn't be doing things willy-nilly because then that's not going to produce good results for you. In fact, it's going to backfire. And when it backfires bad. So that's why I think I'm sharing all these pearls with you all so that you all become more educated and make decisions from an informed place. Okay. Too much of rambling. The next one I would like to talk about is N-acetylcysteine. This one is actually um, an amazing antioxidant because it's a precursor to glutathione, which is a master antioxidant, and this one is just absolutely great to use it. Even with immune system support, we need N-acetylcysteine, and it's also at the same time it's a mucolytic. That means it helps to thin the mucus, but this can actually irritate the stomach lining. And if you are someone who has gastritis or stomach ulcers and you're taking it on empty stomach, I think beware because it can really irritate the stomach lining because it's already very thin and it cannot take more, something that is a bit abrasive. So it's better that if you can take an acetylcysteine with food and an enteric coated one and break the doses throughout the day, I think it would be comfortable for you. So this is particularly for someone who has a very sensitive stomach. It's not recommended, it's not that much of an issue with everybody, but with few people, you just need to be careful. I think it's the way you take it, and with food, that's very important. Now, this is absolutely amazing. It falls under the gut and the microbiome support. And this one is probiotics. Now, not all probiotics are created equal and not all probiotics are suited for everybody. For example, I would say histamine producing strains, something like Lactobacillus casei or Bulgaricus, it can actually trigger headaches, anxiety, skin reactions, and even digestive upset for some people. So people who have histamine reactions, I think, don't just take any probiotic off the market because you need to read the label if it is something that's compatible to your body. In fact, when we have a digestive issue, we just think that we can throw off a probiotic at it and get done with it. But that's not the reality because You might be someone who is dealing with SIBO or a LIBO, which is a large intestine bacterial overgrowth. And then using a certain kind of probiotic can actually be a making or a breaking point for you. Because using something like spore-based probiotics are actually much gentler, and you wouldn't have like reactions, for example, gas or bloating, which people can get sometimes when they actually start off newly with a probiotic, and they can have some reactions which is very temporary, like for 3-4 days, because it's changing their internal terrain. So wherein you're killing the bad guys and having more of the good guys to harbor the area, and the bad guys are then releasing toxins, and that can actually cause some bloating, fatigue, brain fog, headaches, even loose stools. It's very case dependent. And you need to be diligent as to what your issue is and in what type of probiotic is necessary. And in fact, it's also said that around 10 billion colony forming units is a good amount to begin with and to re-inoculate your gut bacteria. So how do you do it? You just open up a capsule. If you're beginning it anew, open up a capsule and just take a pinch of it and keep amping up the amount of probiotic in your food. You can just drizzle it over your food, or even you can just have it with some water every 2 weeks, and that can really help. Some people also find some relief with 50 to 400 billion colony forming units. But I would also suggest that people should actually get on to some fermented foods like sauerkraut, kimchi, or pickles, or even congee, miso, or kefir. It's absolutely amazing. And also enrich these probiotics with prebiotics. I think even that's important. Like using greener bananas or using leeks, asparagus, cooked and cooled lentils or potatoes are great. So be careful of your probiotics because it can give you some trouble, and you just need to navigate which one's best for you in your scenario, in your situation. Then the next one is actually magnesium. Now we know magnesium is used in more than 300 enzymatic reactions in the body. But a very specific one which is widely available, because there are many forms of magnesium, but the one which I'm talking about is magnesium oxide. And this one is not the good form because it's very laxative and it can create loose stools, but it can also at the same time irritate the gut lining. So instead, using magnesium oxide, a person can actually go for magnesium citrate, which is much more better absorbable, and it's often used in case of constipation. Something like glycinate, which is magnesium bisglycinate, it can be used for anxiety, sleep, muscle tension, and for long-term use as well. Or magnesium malate, for example, this one is to give you more energy. So it's used in cases of fatigue or fibromyalgia and muscle pain. So as you can conclude that there are many different types of magnesiums, but it again depends upon the particular problem that you're dealing with, and that's when we'll use a particular type of magnesium. Then the next one is berberine. Now, berberine, as they call it, is the nature's Ozempic. It's a powerful plant alkaloid, and actually it's derived from herbs such as Coptis chinensis, Berberis vulgaris, and golden seal. But the problem with berberine, which is actually used as an insulin sensitizer, it can kill all the gut bacteria, be it bad or good, and it can damage the gut integrity. So practitioners actually use it in short cycles for like 8 weeks and then take a break. But I would say rather than going for isolated extract, and we know that the long-term use is not that great. Yeah, you can use it acutely, but I would still say if you can actually use whole herbs, which are much more sustainable to the body, would be much better. And then we come to another one, which is iron. And first of all, always check your iron levels with having a complete iron panel. For example, checking your serum iron, your transferritin, your ferritin, and your percentage saturation. So this is very important just to establish that yes, you have some iron deficiency. But generally the doctors prescribe iron, which is it non-absorbable, the one that's actually constipating and it's very discomforting. It is ferrous fumarate or sulfate, and both of them are not good bioavailable iron forms that one can use. Rather, going for something like hem iron or iron bisglycinate is a much better form. And we need to, of course, find out that why is someone low on iron. There could be excess bleeding due to heavy menstruation, or the gut is bleeding. We need to find out about that by doing a stool test. Or there could be a lot of inflammation or infection because of which the body is purposefully sequestering iron. So that's why looking at the iron panel is so important to know maybe there is excess iron, but the body is not able to utilize it because of some infection. And we need to deal with that infection rather than actually upping our iron with an iron supplement. I mean, yes, people can use herbal medicine, for example, molasses and yellow dog root, and it will improve the iron levels over a long period of time, and which is a more sustainable and efficient way to do it. But at the same time, give the body a chance to get rid of something that it's been dealing since a long time. Because the body is not stupid. It wants to increase the iron levels. It doesn't want you to have your hair falling or keep you pale and cold all the time. It's doing it on purpose. So, yeah, I think we covered quite a lot with supplements over here. And I loved giving you my 2 cents. And I do understand that supplements are such a big part of our well being, but they're just a part. And we do have to look at the body from a very holistic viewpoint. And it's not just, we gulping these supplements down and okay, we are good to go. It's not like that. There's always more to the story. And our main goal at the end of the day is to come to homeodynamics, which is equanimity, where our bodies can easily sustain the stressors and yet thrive beautifully. That was, is, and will always be the guiding vision for anyone seeking wellness and beyond. So, thank you so much, everybody, for listening to this, and see you all soon with the next one. Bye. Take care.